Optimize resource of medical care. To optimize the resource of medical care is a critical problem. If we meet the shortage of resource of medical care, we need to decide the priority of patients who need care. Triage is the assignment of degrees of urgency to wound or illness to decide the order treatment of a large number of patients or casualties. After the epidemic of SARS in 2003, it was discussed about the distribution of vaccine. It is essential problems rather than legal problem. Ethical principle who should be saved. There are many thoughts to decide the order of medical treatment. Save the most lives. Women and children first. First come, first served. Save the most quality life years. Save the worst off. Save those most likely to fully recover. Save those contributing to the well-being of others. Vaccine shortage SARS in 2003. At the epidemic of SARS in 2003, it was serious that vaccine was not enough to people who lived in epidemic area. United States Department of Health and Human Services National Vaccine Advisory Committee announced the determination of priority groups that can vaccine. The group no less than 65 years old is prior to the group from 2 years old to 64 years old. This is ethically criticized by scholars. One of alternative ideas is the life cycle principle argued by Professor Wasserman. It is each person should have an opportunity to live through all the stages of life. These arguments made change of the order of priority groups as public comments. CDC, Center for Disease Control and Prevention, announced the thought about the priority order problem. Who should be prioritized for full vaccine during a vaccine shortage? When vaccine supply is limited, vaccination efforts should focus on delivering vaccination to the following people. And note that no hierarchy is implied by order of listing. However, in this list, the order has been amended. It had better to prioritize the group of children aged 6 months through 4 years. At the same time, it note that the likeliness of severe influenza illness of the aged. This means, even now, the frontline medical staff need a difficult decision-making who they save, euthanasia and emergency rescue. In this session, we discuss about the euthanasia and emergency rescue. In Netherlands, problem that is difficult to solve emerged. The news report, Asahi newspaper, 18 April 2020, the Dutch Association of Intensive Care Doctors had announced that they take care less than 80 years old. The aged are afraid that they will abandon if they include coronavirus. In Netherlands, the Termination of Life on Request and Assistance in Suicide Act was enacted in 2002. Some aged declare the termination of life when they are incurable illness. COVID-19 is not incurable disease. However, because of shortage of ventilator and staff, in fact, it is incurable. So they are afraid that hospitals deny any treatment to them.